When we come to vaccination, we generally think about children, and lesser known area of vaccination is adult vaccination. Why adult vaccination? When it comes to adults, the main role of vaccines is in reducing complications, reducing amount of infections that they get, and improving the quality of life. Specific vaccines for specific diseases, the doctor will evaluate your need for it and prescribe it if necessary. So as everybody knows, COVID-19 is a vaccine that all adults, irrespective of age and other complications, should be taking 3 doses when it comes to Covaxin and Covishield. Other than that, we'll talk about a few more vaccines and specific disease conditions in which specific vaccines are given. When it comes to age, anyone above 60 years of age, mandatory vaccines are there that need to be taken. First vaccine is the influenza vaccine. The influenza vaccine is for the normal viral flu that we get it seasonally. Generally, people above 60 tend to have other complications like diabetes or blood pressure. So what happens is that the immunity of such individuals are lowered. So it is very essential for them to take this vaccine as a yearly dose. What people at the World Health Organization do is that they study the trends of what kinds of viruses affect which areas, and they release an influenza vaccine every year around the time of July, August, because generally flu tends to hit after August. The second vaccine to be introduced is the Tdap vaccine, which is the basic tetanus, diphtheria and pertussis vaccine that we give children. But when it comes to adults, what happens again is that all these diseases will gain their virulence over time. So it is suggested to take a booster every 10 years for this vaccine. Many people might know about this vaccine because this is one of the mandatory boosters that you need for your international travels. The next vaccine is it's a slightly rare vaccine, is the shingles vaccine. So anyone who has gotten chickenpox in their childhood, in their adult phase, they might have gotten an episode of shingles or herpes zoster as it is commonly known. So what happens is that the chickenpox virus, once it attacks the body, it stays in one of the nerve systems in the body, and when there is any case of lowering of immunity, any viral infection or any other issue, this virus, which is latent in the nervous system, it kind of gets reactivated. So it is very commonly seen around the upper body, and sometimes it might also affect the face. There is a vaccine for shingles which comes in 2 doses. So shingles vaccine, not for everybody, but for someone who has a history of lowered immunity, history of frequent infections, and someone who is already having a history of shingles. When it comes to diabetes, a specific vaccine that we are concerned with is the pneumococcal vaccine. So pneumococcal vaccine is of 2 types. There comes the 13-valent vaccine and the 23-valent vaccine. If you have not been immunized prior to this, the best route to go is to take both vaccines at an interval of 6 months and the booster every 5 years. Why we are specific about this vaccine is that very common in diabetics. This vaccine will really help with managing the complications of pneumococcus. Pneumococcus causes a type of pneumonia in diabetes patients. So it is encouraged for them to get this vaccine initially as a 2 dose and then a booster for every 5 years. Many of us would have gotten the vaccine in our childhood, but since we are specifically taking an interest in geriatric population, I wanted to talk about this vaccine as this was not available in their childhood. So it is better to take the vaccine as soon as possible, as it is a very common disease, hepatitis B, more virulent than HIV and far-ranging complications. So the hepatitis B vaccine comes as a 3-dose vaccine at 0, 2 and 6 months. So special cases, I wanted to discuss liver disease, as liver disease is very common when it comes to adults. When it comes to liver vaccines, we have a hepatitis A vaccine, a hepatitis B vaccine and the PCV vaccine, which is hepatitis A specifically because the gut immunity is also going to be low. It's generally spread through contaminated food. The other vaccine for international travel, the MMR, that is the measles, mumps and rubella vaccine, along with the chickenpox vaccine or the varicella vaccine. This is a mandatory vaccine for many countries. Children are being given the vaccine by schedule. So adults, whoever are in risk for it, who are in contact with children frequently, are better off getting the vaccine, and those who want to go for international travel, they are very much advised to get it. So when it comes to immunity lowering diseases, we put them in two categories: HIV and non-HIV diseases. So when it comes to HIV, we need to be really careful because the whole immune system is damaged as such. So we have something called the CD4 count. So depending upon the CD4 count, we decide on which vaccines to give. If the CD4 count is low, we go with safer vaccines. Apart from all of this, not exactly geriatric, but up till 45 years of age, all women are advised to take the HPV vaccine, more commonly known as the vaccine against cervical cancer. So this vaccine can be taken by all women who are not pregnant or breastfeeding under 45 years of age.